So why do I believe that it's so critically important that the patient's voice be heard at these medical congresses? Because only the patient can give the patient's point of view. Let me give a particular example with my cancer, chronic lymphocytic leukemia, or CLL. The provider, the physician taking care of a CLL patient, has to understand how we weigh the adverse events, long-term and short-term. The short-term problems, the hair loss, the nausea, the infusion reactions, the low blood counts, even the risk of infection, are relatively minor in our calculation about why we're not crazy about chemoimmunotherapy. What really bothers us about chemoimmunotherapy are the long-term problems. The increased risk of secondary cancers, which is already extremely high. The damage to our immune system, which can long-term increase our risk of infection. And we're particularly worried about how chemoimmunotherapy often selects out the most resistant clones. So when the disease comes back, it can come back in a refractory and very difficult to treat state. Understanding this is critical for anybody taking care of a patient with CLL, and there's similar issues in patients with other disease states. That's why it's critical to have the patient's point of view at the lectern explaining what's important to them and what's not important to them when considering their therapeutic options.